Hello, fellow Cardinals. My name is Daniel Malik. I am a graduate student at the University of Louisville School of Public Health and Information Sciences, and I am also the Vice President for the Student Government Association Council. Today, we have gathered to discuss the importance of the COVID-19 vaccine, and also we will discuss some of the hesitancy and distrust that we have with our efforts to reach herd immunity. Joining us today is Dr. Mark Burns, who's an associate professor with the Division of Infectious Diseases at the School of Medicine, and Dr. Paul McKinney, who is the associate dean at the School of Public Health and Information Sciences. Thank you for joining us.
Thanks for having me.
So we will dive right into it. And so, Dr. Mark Burns, can you briefly discuss the COVID-19 vaccine? Why is it beneficial to get vaccinated, and if there are any disadvantages that we know of?
Okay, well, the COVID vaccines have been developed for fighting against the COVID-19. The advantages, of course, are that you yourself get vaccinated and it will prevent you from getting COVID-19. In addition, it can also prevent others that may be susceptible to serious illness from COVID-19 from getting COVID-19 from you. And then finally, if you happen to get COVID-19, it shows that you will not be seriously ill with COVID-19. That is, it should not result in you being in the hospital or dying as a result of COVID-19. Those are some of the advantages. Disadvantages, in my opinion, there aren't any really disadvantages. Some people will say that a disadvantage is that when you get the vaccine, you may get muscle soreness where you got your shot. You may have headache. You may feel fatigued. Again, these things are not really disadvantages. These are actual good things because this shows that your immune system is actually working. It's waking up and responding to the vaccine. So again, I don't really consider it a disadvantage.
Thank you for that, Dr. Mark Burns. Next is going to be Dr. McKinney. Dr. McKinney, what is herd immunity? Why is it important, and how can we get there?
So herd immunity was a concept that was developed, originally about 100 years ago, that has to do with circulation of virus in a potentially susceptible population. And the idea goes back to what cattle do when they want to protect a vulnerable member of their herd. They circle around the youngest member, say the calf, who might be under threat by a wolf on the outside, right, to protect them, so that the person without their own defenses is protected by those who have the defenses based on their size and their capacity to defend. So in the same way, a person who is immunized helps to protect vulnerable people who can't be immunized for whatever reason or won't be immunized from getting infection. And what it does, in essence, is to slow down the circulation of the virus to the point that it will eventually disappear. It can't be transmitted effectively anymore in that population. The advantage is, once we reach herd immunity and the viral levels continue to decline beyond that point and vanish, we'll be able to get back to sort of the old normal, or at least pretty close to the old normal, we hope. And the faster we can immunize, the faster we'll get to herd immunity and be able to get out of the patterns that we're in currently, where we're forced to socially distance and wear masks in all situations and so forth. There may be some limited requirements for doing that as we transition, but it should be a great deal different once we get to herd immunity.
Thank you for that, Dr. McKinney. So next we're going to ask the most important question that we have gathered here for today. Dr. Mark Burns, historically, why do we see vaccine hesitancy, especially in the minority groups?
If you look at the history of this, there are usually two examples that are brought up. First, it's usually the example with Henrietta Lacks, who was a black female who had cervical cancer. The abnormality that was expressed in her cancer cells were actually captured without her consent by another oncologist, And what had happened was her cells were actually harvested, and her genome was actually eventually published, again without her consent. And so this was considered one of the things that, when people talk about vaccine hesitancy, that they weren't informed about something being done. But probably the most egregious example that you would hear about is the Tuskegee Institute experiment that took place in 1932, when they enrolled several black sharecroppers and promised them free burial, free treatment, free medications for what was termed at that time was bad blood. In essence, however, the Public Health Service, which ran this experiment with the Tuskegee Institute, was in fact a study of untreated syphilis in patients. They didn't give them syphilis. A lot of the black sharecroppers had syphilis. The egregious part about this was that even though there was a treatment available for syphilis, they were never given that specific treatment. And instead, they watched, again, the natural progression of syphilis and what it did. And even though they were seen by doctors, even though they were likely given saline injections, they were never given the appropriate treatment for syphilis. And it wasn't until 1972 when a news reporter got a hold of the story, if you will, and was about to break it, that the experimentation stopped. But again, that type of those type of examples were what were out at that time, and it has sown mistrust, particularly in the black community, but in truth in all minority communities, toward the government when it comes to receiving any type of medication or any type of suggestion for the government as far as what people should do.
Thank you, Dr. Mark Burns. So I want you both to take turns on answering some of these questions. One of them will be, what are some myths and false informations that should be debunked about COVID-19 and the vaccine itself?
Okay, well, I'll start. One of the myths is that with COVID-19 vaccines, that it gives you COVID-19. Okay, that is absolutely false. What it does is it gives you part of the actual virus. Now, it depends on which platform we're talking, but but the whole principle behind vaccination is to expose you to the virus, either a attenuated or weakened form of the virus or portions of the virus, so your body can respond to make antibodies against that. And so you don't get the entire infection, but you do get parts of it so your body can make antibodies in case it is exposed to the actual infection.
So there are many other ideas that are out there in circulation, like in social media. Some of the wilder ones are that the government is monitoring you in some fashion through what they're injecting. That there's some kind of chip or monitoring device that's injected with the vaccine that allows them to track you and know your every movement. Of course, that is not true. Another one that I've heard about as recently as yesterday, because people mentioned it, that it's been in circulation in their social media circles, that the vaccine may cause infertility, that it may cause inability to have children. And of course, that is manifestly untrue. There are many people who've received the vaccine who were pregnant when they got it, and there are many who got pregnant after getting the vaccine, and none of those individuals that we know of have had an adverse event as a result. Now, there are special studies ongoing, women who are pregnant who've gotten the vaccine, just to make sure that there's nothing else that's eluded us. But at this point, no evidence that it's harmful during pregnancy, and no evidence that it can cause infertility.
Sure. Thank you for that. Lastly, Dr. McKinney, how can we public health students advocate and change the stigma for vaccination in the minority group? What can we do different and better?
Well, I think the most important thing is to know the data, know the facts, to go through the information from the clinical trials, and certainly we, the faculty, can help educate students about exactly what was discovered in the trials and help them interpret the information. But those data are actually very reassuring in terms of the benefits that the vaccine provides and the low incidence of any significant side effects. Now, Dr. Burns mentioned that people get sore arms and they may get headaches and low-grade fever and so on. But those are like known and expected effects. There's nothing severe, life-threatening, etc., that it's going on other than the very rare anaphylactic type reaction. Those occur a few times in a million, and we are aware of them, and we have preparations for them should they occur, and no one has ever died as a result of those because preparations are always present at vaccine sites. So I think knowing about the data is the most important thing, and then sharing the information with each other and with your peers who are outside of public health, your friends, your social groups, your families, your communities, and also in participating in events that allow the vaccine to be distributed more widely. We've got a big activity coming up at Cardinal Stadium in a few weeks that will seek to vaccinate thousands of people a day. So students who are interested can participate in that in a variety of different ways, assisting people with signing up, getting appointments, making phone calls, tracking data, doing interviews, helping people fill out questionnaires and so forth that are part of the process, and helping in also doing surveys. There are surveillance, I should say, of people who have gotten the vaccine to make sure there's nobody who's suffering an immediate consequence. Again, an extremely rare event. We do have our systems in place that will be able to respond to that should those ever occur.
Thank you for that.
I'd like to add something as well too. Also, I think from a physician standpoint, particularly black or minority physician, I think number one, acknowledging the transgressions that have occurred in the past. Number two, being transparent. And number three, communication with people, answering questions, letting them know what things to expect. Answering all questions and being upfront and honest about everything, I think will help ease a lot of tension, a lot of anxiety in the people who are vaccine hesitant. Reassure them, and then finally, I feel leading by example. I know Dr. McKinney and I have both been fully vaccinated, but leading by example I think will help ensure trust and let them know that we are part of this. We are being honest and upfront about it, and so they can actually follow our lead, and hopefully we can all overcome all this and crush this virus.
Most certainly. Thank you, Dr. Mark Burns. This concludes our vaccine hesitancy segment. I take the time to thank you, Dr. Mark Burns and Dr. McKinney, for joining us to help us answer some of these questions. And if you, our fellow students, staff, or faculty have any questions regarding the COVID-19 vaccine or the hesitancy surrounding the efforts, please feel free to reach out to us if you have any questions. Thank you for joining us.